Hello, welcome again to Miami Community Health. I'm Dr. Anthony Gonzalez here for another important health topic. First, I want to wish you a happy holiday season, a Merry Christmas, and a Happy New Year. That 2024 will be a very prosperous and healthy new year for you and your family. And today we have another important health topic. This is a health topic that kind of hits home to me. It's close to me, my wife, and our family, but it's something that I don't completely understand. So if I don't understand it, I have to obviously bring an expert for all of us to understand it. And we're going to talk about ABA, BCBA. We're going to talk about neurodevelopmental disorders. We're going to talk about complicated stuff, a lot of acronyms and so forth. So I brought a friend, a colleague, another doctor to talk with us, Dr. Frank Perez Verdecia. Welcome.
Thank you, Anthony.
All right.
Thanks
well,
for
welcome.
having me here.
So first, why don't we start off by just telling everybody what you do? Who are you and what are you doing?
I'm Dr. Frank Perez Verdecia. I am a licensed psychologist in the state of Florida. I am a specialist in neuropsychology, and I am a board-certified behavior analyst. I am the clinical director of two important clinics here in Miami, Health of Mind in Psychology and Beyond. Health of Mind is a clinic that specializes only on treating, providing services to children with autism and non-autistic children as well with severe behavioral problems. While Psychology and Beyond specializes in a broader category of psychology, mental health, from dementia to depression. And we have a group of doctors and psychotherapists working there. So probably for the purpose of this conversation, we're going to focus on health of mind and how we provide services to children with autism and other neurodevelopmental disorders.
And so how did you get into all of this neuropsychology type of area?
Good question. So I guess a psychology is too broad. I mean, if I do this, it may be that I am resistant to your questions, I am anxious, or I'm just simply cold, right? So it's everything in interpretation in psychology. And I guess that that ambiguity led me to a more concrete field of psychology. So neuropsych gave me that understanding and comprehending better the brain behavior relationship. That's why I fall in love with neuropsych. And then behavior analysis it gave me the tools to effectively work more with this population, like more diverse population. I have tried multiple psychotherapy techniques and multiple interventions, and behavior analysis was the one that gave me that effectiveness, that unique approach to treat this, broader population. It's a data-driven. When you think about it, it's subjective. There's no mentalistic terms there. Everything is, we will both agree that something is happening. So that's why I fall in love with neuropsych to comprehend. I would say that neuropsychology gave me the whys, and then the behavioral analysis gave me the how.
Okay. And so explain also to our population BCBA. Yep. What is that? What does that mean?
It's an independent field. They are doing their best to divorce from the mental health, from the psychology. So again, it's data-driven, it's subjective, concrete, tangible. Everything is analyzed pre-treatment, post-treatment, how we see the graphs moving and everything, versus psychology and neuropsych that is, as I said, it's psychology major. You focus on other aspects, including neurology and medicine, but it's complete different. It has a specific field, it's distinct discipline. It's like, I would say that in medicine, it would be like MD and a pharmacist, an MD and a neurologist. In medicine, you're supposed to have an understanding of pharmacy and nutrition, but then these people are specialized in nutrition and they go specific courses into that. That's what happens in psychology and at BCBA. Stands for Board Certified Behavior Analyst.
And there's something you said earlier, and I want to clarify. When people have problems with behavior, you can understand why they have that problem with behavior?
Correct. So every behavior has a function. Every behavior has a function. So we can broadly categorize them in four categories. We can say that every behavior may have a function to seek attention. It can be positive or negative attention. It can be also comfort, right? The other function of the behavior can be for access to tangible. I want to go to a park. I want to go to a movies. I want this lollipop. It can be also escape function. So if I want to escape from an activity, hey, let's do homework, and then I engage in this behavior, then I'll escape, at least temporarily, from that activity. Right. And then the fourth one will be sensory, that it can be that these lights are too much for me, and then I stay engaged in a tantrum or something like that, for me to understand and analyze that the function of my behavior is particularly related to escaping from that sensory stimulation, or the opposite, that I like the sensory stimulation.
And you guys, obviously, your job is try to figure out where they fall in those buckets.
Correct. One behavior can have multiple functions. Think about it. If a tantrum is a great vehicle for me to have a tangible, for me to have to escape from a homework, and for me to seek attention, then it's a great vehicle. So that's why it's very difficult to treat these behaviors, because every time I want something, I don't want something, I will engage in that tantrum, and then that's it. You know, I escape, or I got what I wanted. So it's very difficult to treat, but once you understand the function of that behavior, it's a click, you know, it's easy to treat.
Oh, God. Well, I'm glad somebody understands it, because I definitely don't. All right, so let's talk about neurodevelopmental disorders, and what is that type of condition? Obviously, I know a little bit about that, because as you know, as somebody who's taking care of my kids, you know, I know a little bit about neurodevelopmental, but let's explain to the population and to our audience in general, what is that?
Neurodevelopmental disorders are a group of conditions that affect areas of living. So we can say that that affects language, affects social skills, adaptive functioning. It's just they have unique characteristics. When you think about it, it has to have early onset. Neurodevelopmental disorders is such a big spectrum, especially with autism. It's such a big spectrum, because you may have a person with a particular limitation of functional impairment, but they may excel in other areas, right? Mm-hmm. So we can name them as try to explain what they are, or name the conditions. We have autism spectrum disorder, which is widely known today. It's a spectrum, right? We have ADHD, we have learning disorders, and then in neurology we have the dyscalculias, the dyslexia, the agraphias, and all that. We have the communication disorders that they may have they may have an expressive or language disorder. I was about to say facials, like talking about neuropsych. They may have motor disorders, sensory disorders. So those are the group of neurodevelopmental disorders that we treat. Mind you, in behavior analysis, you don't have, well, for certain insurances, yes, but you don't need to have a neurodevelopmental disorder to be treated with behavior analysis services, as long as the behaviors are problematic, and they have like significant functional impairments, they are enough to receive behavior analysis therapy. So think about behavior analysis, that if you want to be a better surgeon, I know that it's impossible, right?
Every day I want to be a better
impossible.
surgeon.
Behavior analysis will give you those techniques for you to be a better surgeon, because it's all about manipulating variables that will make you a better surgeon. But when we talk about behavior analysis with neurodevelopmental disorders, we're specifically talking about medical necessity, because I can apply behavior analysis for educational purposes, but the insurance don't cover that. You know, it's just for medical purposes only. So it's just like, you know, we can use behavior analysis to improve everything that you would like to do, or decrease certain behaviors that you don't want, even for self-management. But when we talk about behavior analysis, I would say the first thing that comes to your mind is the medical necessity part of it. Okay, this child has these high-risk behaviors, and we need to decrease the behaviors and replace them with what?
Now, as for the adults listening, you deal mainly with children in that one area. We're going to talk about the developmental. What are some of the signs and characteristics in youngsters that parents, grandparents, families, and friends should be looking out for, that they'll be concerned that, hey, you know, I need to seek evaluation by a psychologist. I need to take them to their pediatrician. What are the things that we should be worried about?
You know, it's interesting, that question, because since for example, autism is such a wide spectrum that we can have a person that communicates very well. The expressive and receptive capacity are there. But then you may have some sensorial part. They may have some food refusal, and it's very difficult for them to eat certain textures and things like that. And they may socialize differently, or we call odd or weird behaviors, right? So I would say the answer is people have a very good understanding about what is different from my child. And that's when they need to bring the child to us. Like, hey, is this normal? Well, we don't want to call normal, but is this okay? Is this functional? Because, I'll give you the speech of a typical doctor. No, if you see that he's behind in language development, if you see that he's behind in social development, in motor skills, in sensory, graphs, and everything. But parents are very good judges of what is wrong with their child. Parents are pretty good on that. So every time you suspect that, don't wait. Just seek for a professional consultation. Go and, hey, is my son okay? Is this fine? Is this going to go away? Is he going to grow out of it? That professional consultation is very important. And that would be the long answer.
And is it ever too early?
No.
But earlier is better, right?
Earliest better. Earliest better significally.
Okay, yeah, I've heard that. That's one thing I know and I've heard and I've learned that earlier.
We cannot wait to the very end to start treating difficulties. Definitely.
Wow. And then is there anything wrong with taking them and then you see them, you say, you know what, your child's okay. Your child is fine. There's nothing wrong with that either, right?
Correct. So, for example, in my case, that I have two hats, right? As a doctor and as a therapist as well. When you have that type of consultation, you may filter what you are going to do. Hey, I want this is not severe enough. This is not problematic enough. Let's treat you with parenting training, for example. Your child is too little, so why should you bring him to the office? Is everything amusing there? Everything is fine. So he's not to engage in problematic behaviors in the office. So let's work in the community, right? Let's work in your home. But since he's not severe enough, let's provide you with some parenting training. How you can manipulate certain variables that can help you understand your child better, why he's engaging in those behaviors, and how you can manipulate those behaviors. Now, if it's severe and it presents like important impairments, then okay, let's work now with the behavior analysis. So the earlier the better, but the tools out there. So seek proper consultation, and then we can help you with that.
So that's what I want to hear about. So I bring my child to you, and what happens? What's the process like? What is the evaluation? And let's talk a little bit about the evaluation, and then obviously the treatment plans.
Correct. So they seek consultation. Hey, this is the situation. My child is not communicating as my older one, for example, as a typical complaint. And then we will decide if this is how he deviates from the norms, right? Because now with the neuropsych, we can say, okay, this is the norm. This is what your child's supposed to, this is the repertoire of vocabulary that he's supposed to have at this age, and he doesn't, and he's communicating like this, or he's engaging in this behavior because of that. So we filtered that, right? So his typical or not, what we call neurotypical or not, okay, you are fine. And he's functioning or not, he's communicating well or not. If not, then we'll categorize them into, if it's not severe, he may go to a psychology clinic, right? So he may go to Psychology and Beyond. And then we'll admit him to that program, but in a less intensive and less invasive approach. If he's significantly compromised, then we take him to the behavior analysis part. So he comes so that second interview, he comes to the office, and then we'll start manipulating the child with the chief complaint that the parents are bringing. So, for example, the same communication that we're saying, we'll start manipulating the expressive and the receptive parts and other areas of functioning, not only that. So I have like a better understanding about what's going on, what are the strengths and weaknesses that a child has. And then once it's submitted, I start developing a treatment plan that a behavior analyst is going to implement in the community, okay? And then we monitor the data if the behaviors are decreasing or not. So I would say the first step is, are there problematic behaviors? Are there, for example, physical aggression? Are there property destruction, self-injury behavior, pica, elopement? I mean, you name it. Most of the children that we have, not all of them, but they are very compromised in those areas. They have like a very strong maladaptive behaviors to have access to what, right? Or to escape from what. So that's the process. And then we try to stay with them for a long time to try to monitor that data. The more severe they are, or the more impaired they are, the longer they are going to be with us. The less severe they are, the shorter.
And what are some of those time periods? What are some of the time periods that you see that patients can be with you, those children?
So a child that is very compromised in many areas of functioning, talking about, again, for example, autism, he can be for a very long time, I would say years, in treatment, because the development of those skills are not easy to acquire for them to learn. And remember, those behaviors or problematic behaviors that they have are very, very, very strongly reinforced. They know the consequences. For me to replace those behaviors is very difficult. So for very compromised children, they stay for a very long time and want to make sure that they will accomplish all the milestones in their life. For less compromised, I would say a year, something like that. And let's talk about, for instance, about the ADHD, because autism has been receiving this type of treatment for a while already. I would say a good 20 years already. But ADHD, what is the first approach that comes to teachers and everybody? Medication management.
Yeah, always medication.
Medication management. And it's not that we're against the medication management, but we want to take, like a step back a moment. Okay, let's try a behavioral approach first. Let's try to modify certain behaviors in the environment, of course, certain aspects in the environment to modify the behaviors. Sometimes even a school accommodation is enough. You don't have to have autism. Just a child with ADHD with a school accommodation, sometimes it's enough. Sometimes we need to see if we need to assign an RBT, which is a registered behavioral technician, next to him for a list of him to get the necessary skills to succeed in that particular grade. So it's just, let's try something invasive, but not as invasive as medication before we go into that area.
Well, great. And so obviously we understand that not every child is going to walk and talk and do everything possible because there are some probably underlying congenital issues. But, what are some of the barriers along the way, and what are some of the obstacles that you have to overcome to try to progress with the treatment plan of these children? Are the parents helpful? Are the parents sometimes not the best advocates for their own children, or are they? Where do you run into problems?
It's variable. Most parents are good advocates for their children, I would say. Sometimes they may be inconsistent. Reason why they are here because they are not behavior analysts, right? So how many times you have a visit in your house, or you're in a restaurant and you want to implement the behavioral analytic intervention that I gave you, you're like, no, let's just have a shortcut. Let me get the lollipop and let me continue talking, So sometimes it's very difficult, but that's why when we have a non-emotionally involved person, it's more effective than us. So parents are typically good with that. I would say that the most important barrier that we have, or that we all clinicians experience, are systemic ones. For example, I am a doctor. Why should I wait for another doctor to give me a referral to treat a child that sought consultation with me? So they come to me, and I have to say, yes, this is the diagnosis, but now you need to go and get a referral and then come back to me. Those type of systems requires improvement. And it's an unfortunate, but, that's the system that we have. But so that's one part. The other part are related to schools. Schools, they are the approach or support is variable as well. Some schools, they are very supportive and they want to, incorporate this type of treatment, and others are very resistant to that. So those are the two main ones that we experience. Of course, we have the typical insurance, the typical, delays in service and things like that. But in general, it's a good treatment, it's a good approach, and we are very, we receive, what we are doing today is paramount because we're disseminating more knowledge, and more
Yes.
clinicians understand better this. And this, as you say, these acronyms, what is that? BCBA, neuropsych, what is all that? So the more we educate them, the better they understand that, yes, you don't need to have an autism to receive behavior analysis. As long as there's a problematic behaviors, we have children with criminal activities, and we need to treat them as well.
Wow.
So everything is within that category. So
And at the end of the day, it's like we always say, and it's like you say, it's all about the patient, it's all about the child, it's all about helping them.
Correct.
And you just want to help them, but there are going to be barriers along the way. So obviously we've heard about some of the barriers. So tell us about some of these, the prognosis for these youngsters and what happens in the long term. And, tell me, will they become independent? Will they be able to do all their things by themselves? Talk to me a little bit about that.
I'll stay here talking about that for a long time.
That's why you do this, because of all those great stories. Yeah.
Yes. So my beginning in this was treating adults with developmental and intellectual disabilities, right? Children with, adults with autism and formerly known mental retardation and all that. So for me to understand how the necessary skills that these adults need, and working now with children, I say now, but it's more than a decade, but working now with children give me like a very complete picture about how is that I need to work with an adult and a child. So the necessary skills that they need to work. So the prognosis is related to the spectrum, the severity that they have, how compromised they are, and how early we start implementing those interventions so they can successfully go into independent adult life. It's amazing. I need to give this hope to our parents. It's amazing to see how your children will potentially be able to work, probably in a supported environment. I'm not saying that. Supported environment, I mean like they will have like a supported living coach and supported employment coach and things like that in case that they are really, really, really have limitations. But if not, you'll be surprised how they will work in the community, how they will be able to socialize and live an independent life. You will be surprised.
No, I am surprised, and we're thankful as well as parents, because we've been able to see that in our own children. So yeah, I echo what you're saying, and I agree with you 100% that it is possible, but you have to intervene. One of the things that my wife always says is you can't be in denial. The parents are in denial and they don't believe that this is happening to their child. Get beyond the denial that, let's help that child,
Correct.
Bring them to a professional like you to get evaluation and to get treatment so that eventually they can become successful adults, and so forth.
100%.
So what's the future like? What's the future for ABA, BCBA, and for these neuropsychological areas?
I would say that the future is promising. This is, especially with technology evolving, like artificial intelligence and things like that. I would say that regardless, we're always going to need a program implementer, right? So what I see in the future is, and I see it today, that what is evolving is the assistance of this technology, like, once again, the artificial intelligence. And that helps us a lot with the treatment planning, with trying to identify motivators that keep the child engaged in treatment. So the future is like that. It's like we will depend probably in, some cameras that automatically will give us account of the behaviors, so help us better with the graphing area and all that. But in general, the future of behavior analysis and the future of treatment with autism, it always will require a human being to help, somebody. That human factor is very important because that's what they are lacking many times, and they need that type of social interaction. So I think I would say this is the beginning of behavior analysis. I would would love to see how we can finally implement behavior analysis for another audience that is also medically necessary. For example, dementia. For example, neuroacquired disorders that right now is very effective, but it's not medically necessary.
Wow.
Can you imagine you and I, Anthony, that we suffer a stroke, for example, or just a TBI, and then this is our level of functioning, and then now all of a sudden we are here. Yes, we had this spontaneous neurological recovery phase of 3 to 6 months for the neuroplasticity and things like that. And after that, what are you going to do? You need a behavior analyst to help you develop those skills again so you can rehabilitate to at least close to the previous level and baseline. So that I see that promising, and I hope that the future incorporates more, all the fields in medicine incorporates more behavior analysis. I'm not, this is like I'm preaching behavior analysis, but pretty much the purpose of this conversation is to disseminate knowledge for families, especially for children with autism and just problematic behaviors in general, because we want to help them. This is probably the main focus of this conversation is, hey, you have a child that may have some difficulties, bring it. Let's have a professional consultation. If there is something that is wrong, I'll let you know that if it's wrong or not, if it's treatable or not. Everything's treatable, but how we're going to treat it. So,
and what the prognosis could be for your child, and what the
prognosis would be. Correct.
No, I think for me and my understanding, because I've learned a lot, and I'm sure that our audience as well, that obviously parents know if there's something wrong with their child. If you have a suspicion, bring them, and we're going to understand how where they should bring them, but. Bring them for an evaluation, and then they get evaluated. You will tell them whether this is in regard to the norm or this is acceptable or not, and then you will begin some type of treatment plan. And the treatment plan could be months and years, and it could be lifelong. But what I'm understanding is, and I know, and not only understand it, but I've lived it, that the prognosis is excellent if you do begin the treatment plan and you are consistent with it, and there's excellent success stories. So and of course the future, when you say that we're always going to need humans, people always ask me, you do a lot of robotic surgery. Are the robots going to do the surgery? No, I still have to be there to move the robot and to actually do the actual operation. The robot is just a tool. And you're going to use these tools of cameras and more data analysis and more AI to improve your care of patients as well. So it's going to be great. So if we have a parent, a grandparent, a family member, a caregiver who has a concern, how do they reach out to you and your team to be able to get some evaluations?
Also, the easiest way is go to our website, which is healthofmind.net, or just call 305-917-5414 and seek for a professional consultation. I'll be more than happy to support you guys.
All right. Well, Frank, thank you for coming.
Thank you so much.
Thank you for being here. I can tell you from personal experience, Frank is taking care of our children, and we've seen great progress in our kids. So this is a very important topic. We want to educate our community. We want them to understand about these neurodevelopmental disorders, and that there is hope. There is a future for these young adults, these young kids who will become young adults and who will be the next generation of our society. So on behalf of Dr. Frank Perez Verdecia, Dr. Anthony Gonzalez here, welcoming you back to our show and welcoming you to our new year. Thank you for joining us today. Have a great day. Be healthy. Take care of yourself and your family, and Happy New Year.